students. Hope you're all doing good. So this is Dr. Sowmya here, the CEO of StudyMedic. I am welcoming each one of you to the OMR series. So you must be wondering, what is this OMR series? This is a YouTube series which can help you all to prepare very well for your OSCE. Basically, we are trying to bring across a lot of different creative things to help you all to kickstart for your OSCEs, and we want you to clear that in one go. So as you know, success is just the tip of an iceberg, which will have a lot of all these things: hard work, persistence, late nights, rejections, failures. So we want you to overcome all this with ease. That's why this series, which is called OSCE Made Ready, that is OMR series. So basically what we are trying to do is we are making the OSCE very easy by dividing that into simple steps and a role reversal. That is, your mentors would be acting as the students, and what not to do. In each of the tasks, everybody knows what to do, but it's very important to know what not to do and the salient points of each task, what we do. Okay, so this is all the probably a panoramic view. So I welcome each and every one of you who is preparing to give your MRCPI OSCEs. Okay, so today we are going to do one task, and this would be a short case, and definitely probably this would help you to understand how well you can do these type of negotiation tasks when you get in the exams. Okay, yes, perfect. Aisha?
Yes.
Here I have my wonderful friend Aisha, who has been kind enough to be the role player for me. Okay, so that we can enact. She would act just like any other patient whom you can come across in real life or in the patient or in the probably in the exam. And let's see how to tackle this. I'll try to do the minimal mistakes and let's see how it goes. Yes. So as you all know, there is no reading time, and the reading time is inclusive of the 10 minutes. So that's what I'm going to do. I'm going to start my timer, as well as this is the task which is given to me. Okay, fine. Okay, let's start. Yeah. Mrs. Amy Whelan?
Yes, I'm Mrs. Amy Whelan. I'm 36-year-old.
Hello, hi, this is Dr. Sowmya here. I'm one of the doctors in the clinic. Is it okay if I call you Amy? Will that be all right for you?
That's fine. That's fine.
Okay, Amy, so thank you so much. I'm meeting you on behalf of my consultant. I'm aware that you were waiting to see the consultant, but my apologies because consultant is busy and I have been trained to see the patients. So that's the reason I'm here. Hope that's okay. And definitely after this, I can put you in touch with my consultant. Will that be all right?
That's okay.
Okay, thank you so much. And Amy, I can see that you are here because to have a plan for your delivery, and I can see that you have a wish list, which is very nice to have for a delivery. So is it okay to discuss about the same? So if you could tell me, how can I help you today?
Yeah, I am into my second pregnancy and I'm 36 weeks now. I want to discuss about my birth plan, as you said. You know, I'm wishing for home delivery. I'm just, I'm hoping for that.
Okay, definitely, Amy. Home birth is something which is a very natural, because you can deliver in your natural environment and you can take care of definitely your household chores as well. I would definitely help you with that. But before that, I need to know a couple of details about your pregnancy, the present and the past one. Is it okay if I ask you questions?
That's okay.
Yeah. Could you tell me more about your first pregnancy? I could see that this was a cesarean delivery. So could you please tell me about that?
Yeah, that was my first pregnancy and I was so happy. My pregnancy was smooth, and I was in the midwife-led unit and everything was okay. Suddenly, my midwives told me that my baby's heartbeat was dipping, so I had to rush to the hospital. So many people were there in the hospital, everybody coming, going. It was such a, not a pleasant memory at all for me. And then, they decided for cesarean section. That was emergency. I didn't even have time to talk to my partner, which I really, really regret even today. And Then they rushed me to the theater. They did a C-section, and the baby was taken to, neonatal care unit. And I didn't even have the chance to meet my baby and have skin-to-skin contact. That's the reason, I just want home delivery so that, I can have a pleasant memory at least this time.
Okay. Amy, I'm really sorry. I can see that you really didn't have a experience. It might have been very unpleasant for you. I'm really sorry for whatever happened. But I would really want to know, can I know your baby's name? How is the baby doing now?
Baby is Jack. He's doing fine now.
I'm really glad that even though what you felt wasn't great at that time, but we could take care of Jack well, and he's really doing good.
That's
So,
right.
and as you rightly said, probably that time it might be because they were worried about the Jack, and that could be the things which they have taken. But I definitely understand probably whatever the things which you have gone through, and that's the reason probably you have this wish list, right?
Yeah, definitely. Yeah.
Okay, couple of things before we discuss about that. So may I know, like, how is this pregnancy has gone so far? Is everything okay?
So far, everything is okay. My tests, my scans, everything is fine. That's the reason I'm telling you, I just want home delivery.
Yeah, sure. And also, like the previous pregnancy, apart from this experience, the recovery period was quite good, right? There was no problems at all for you.
No problem for me. Only for my baby Jack. He was in the unit, so I couldn't meet him very often. That's the only concern I had at that time.
Okay. And you are into your 36, you are 36 year and you are into your 36 weeks, right?
Right.
And do you have any allergy to any medicines or
No,
any?
no.
Okay. Apart from cesarean delivery, have you undergone any operations at all?
No.
Okay. And are you generally fit and fine?
Yeah, I'm fit and fine.
Okay. And also I want to know, how is the support at home?
Yeah, my partner John is very supportive.
Okay, that's fantastic. That's fantastic to know. And if I may ask, how far you leave from the hospital? Like what's the distance? Like how much time you take to reach the hospital?
It's only 10 minutes, doctor. And that's the reason I'm telling you I need home delivery so that I can rush if there's any problem.
Sure. We shall discuss about the same in a while. And also, I know this probably might not be a question to ask at this point of time, but it can help me to explain you better. What's the extent of the family you are looking at? Do you really love to have more kids and things like that?
Yeah. I have, 5 siblings now, and I would like to have Jack the same. So I'm planning for more children. Yeah.
That's wonderful. Okay. Amy, so just to quickly summarize things, like you are into your 36 weeks and you're wishing to have your delivery at home, and because of the unpleasant experience, what you had got. And the first one was a cesarean section, and you are not allergic to any medications, right? Anything else which
Right.
I've forgotten to add or anything?
Yeah, that's it.
Okay. So coming back to your wishes, definitely, as I mentioned before, home birth is a very natural process and natural birth, right? So you are in your own environment, familiar environment. You can be constantly in touch with your partner and Jack as well. But coming to the things which you have mentioned here, see, we can always help you with a couple of things from the whatever the experience you've got. The only thing which we need to think is the woman with a cesarean delivery. We need to make sure that wherever you deliver, it has to be safe for you and the baby. Okay, so
Yeah.
that's our prime concern, right?
Mm-hmm.
So what happens is the woman with a cesarean section, there is always a possibility of scar giving away almost in 1 in 200. Okay,
I
so
see. Oh, I don't know what's that.
yeah, the thing is, like the scar, whichever has gone on your womb, because of the pressure of the labor, the pain, it can open up. Not for everybody. But
Okay.
we do have things like we can monitor the baby's heartbeat very well.
Mm-hmm.
I know the
Mm-hmm.
midwife can monitor as well. But here with the continuous monitoring, we can help you to pick it up at the earlier stage. And once we identify that, the baby has to be out within minutes to seconds to keep you and the baby safe. Okay.
Oh, I was thinking, I'm just for 10 minutes away from the hospital.
Yeah.
So any concerns, any giving away of the scar, I
Yeah.
can just rush to hospital. I didn't know that it will take only 2 seconds for the baby to go down.
Yeah, that's one thing. And
Mm.
I can see that you don't want to be tied up with monitors. Don't worry. You can
Mhm.
still be mobile. You can still be mobile. We have some patches like which would be put on your tummy and you can walk around, so you won't be tied up.
Oh, I see.
Yeah. Yes. And also you don't want too many people around her. You definitely, we will not be putting too many people around you unless there is any emergency, which we will inform you. Okay. Otherwise, there will be a named midwife and a doctor who will be visiting you.
Okay. Okay.
Okay. And I can see that you don't want any interventions. Definitely agreed. The pain relief, the pain relief doctor, the anesthetist would discuss with you, and you can choose your options if you wish. And you have also asked for no episiotomy. Definitely, it is not a routine thing where we give the cut to take out the baby. At that point of time, if it is required, we won't be doing without taking your permission. Okay. Okay. And also you want to wishes to have water bath. What about you? Water bath? Do you want to have water bath or you don't want to have?
I do want to have water bath, yes. And more important is I want to have my baby to be with me after delivery.
Sure, definitely. So about the water bath, in the initial part of the pain, definitely we can let you be in the water and we can use water resistant monitors. We can do that. But once you start getting the good pains, it could be difficult to deliver in water, but we would be giving you an alternative pain relief. That is only for your safety. Okay. And definitely the baby will be with you unless there are some concerns for the baby. We will allow skin to skin and we will allow immediate breastfeeding if you wish. There is no problem. And the baby's doctor will be attending as well. Okay.
Okay.
So I do know that your experience wasn't pleasant, but we will make sure that we do all the things possible to help you to, feel better. And because our prime concern is to make sure that you and the baby are safe. Okay. Hope you're happy with the plan.
Yeah, now you have just explained to me the importance of monitoring the baby and how early you have to rush to the hospital. I think I'll have to think over it. I'll discuss with my partner and come back to you about the plan.
Sure. Meanwhile, I'll write a letter to your GP as well, and I would put you in touch with the consultant as well so that you will have the best, whatever suits you. And hopefully this experience is going to be the pleasant. And also, I'll provide the information leaflets as well. Thank you so much.
Thank you. Thank you very much.
Thank you. Perfect, Aisha. We have finished 5 seconds remaining. Okay. So guys, just to tell you all, okay, Aisha, if you wish to tell me any things like how it went and the pace and the tone, whatever, if you have any comments, because definitely would add a value to people.
I don't have much to say, Sowmya. I think you were quite, concerned about the patient, her wishes. You went with the role players agenda. You explained about the birth plan, home birth actually in the beginning, and then went to explain about the cesarean section. I think that was the most important thing to go in a negotiation state. What is that? Negotiation task,
yeah. Yes. So guys, just to tell you the most important thing, this is negotiation. And remember, she's a scientist who is in a very authoritative position. She's not here to listen to whatever you say. So always put her agenda in the front. Ask her why, what, and if you could see, I could talk to her first what she wants and then brought what we can do for her. It was 2 steps of yours and 2 steps of hers, and always check her understanding whether she's okay. Ideally, it's the best way. If you want to remember to check the understanding, you can always call her name 5 times and things like that. And always make sure these patient-simulated tasks, avoid the jargons as much as possible and explain why she has to be here, and always bring back the consultant's level wherever required and explain the rupture, because she said she doesn't know what it is, right? So they might be thinking they could be very near and things like that. Obviously, it is impossible to cover vaginal birth versus cesarean section. You will not be able to finish. So her main thing is she wants to have a delivery. So that's what we were talking about, right? And intermittent auscultation won't be sufficient. If you could see, I covered that crisp telling your midwife could monitor. However, we need the continuous monitoring because I know that the clock is ticking and I have very less time. So essence is negotiation task, exploring the concerns, explain the safety. Always bring, this is for your safety and the baby's safety. Let her choose. Obviously, which mother doesn't want the baby's safety, right? And do not agree for home delivery. That is not your choice. If it has to be, it is to be consultant decision, right? And check the understanding and probably a few things which I could have done better. Probably, like I could have asked the baby's name this baby she has named. Of course, if she had named the baby, if she had told, I would have said, okay, that's good. And actually, Jack, she didn't give me time to talk because I know there were a lot of conversations happening. It's always a good idea to acknowledge. And probably I could have, I don't think I spoke very fast. I let her speak. And the one thing which you guys, if you have noticed, whenever she was telling her story, I was like, okay, yes, I was trying to do that active listening. All that things would add a lot of value to your role player that you are listening to them. Okay. So guys, these tasks you have in MRCPI OSCE, one is a long case where you talk to the simulate role player. The second thing, one short case. So you are getting sort of cases like this. This would definitely be helpful. Okay, so stay tuned. And this is the first of the series. We are going to do the tasks like this, like the structured discussion and the patient simulated task, probably the tricky ones. And this could definitely help you to deal the situations better. Thank you, Aisha. Thank you for all your kindness and support. Thank you. Thank you. And stay blessed. And don't forget to subscribe the channel, guys. All the best. God bless. Thank you and bye-bye.